Here's what patients regret the most about addiction. I've been a board certified practicing family doctor for 13 years. I've been in residency for 3 years, so it would be 16 years in clinical practice. And I started medicine in 1999. I've seen a lot of addiction. And when it comes to you and your health, what you want to do is try to understand it. There are so many patients that I've seen who have been in and out of the hospital with, let's say, a heroin addict who has had problems with like abscesses in the arm, a methamphetamine addict who has had a heart attack. My brother had a heart attack and died at 48 from methamphetamine and alcohol misuse. I myself have been sober from alcohol and drugs since 2018, and I have a sober date coming up here July 31st of 2018 for 7 years. There are patients who I've seen who have been combative when they are on the second day of alcohol withdrawal. What about other things that we don't talk about? What about sugar addiction? What about nicotine addiction? What about fat addiction? What about the path of least resistance addiction? So many addictions that are there. But a lot of the times as doctors, we displace things on patients. You have a disorder, you have a disease, you have a problem. Here's a medication, here's another problem. Instead, I've developed this concept called Mind Hygiene, which is supported by medical evidence, and it's supported by different therapies: cognitive behavioral therapy, dialectical behavioral therapy, eye movement desensitization, reprocessing therapy, rational emotive behavioral therapy, and metacognitive behavioral therapy. And I've been blessed to be able to have gone to all of these and achieved emotional freedom. And I feel good about myself at least 70 to 80% of the day by writing these things down. When it comes to addictions of any kind, what can happen is that if you're addicted to anything, I feel that sugar is the worst drug on earth. I feel that sugar is what pays doctors' salaries: carbs, breads, sugars, fats, chips, path of least resistance, lying down, eating bad, mindless behavior, not knowing what's going on, then having problems with your blood sugar, diabetes, hypertension, high cholesterol, and then stroke, heart attack, and then death. You don't want any of these problems. But what you don't want to do is you don't want to fix addiction. You don't want to fight it. You don't want to overcome it. You don't want to deal with it. You don't want to beat it. You don't want to be strong. What do you mean? Well, there is medical evidence to support mind hygiene, mindfulness-based cognitive techniques where you write it down. I accept that I am addicted to drugs and the path of least resistance, but here's what I'm going to do today. And then you just find a solution. You look at a YouTube short, even that's good enough. You write down what you can do to find the next person. That's enough. You're taking action steps. It could take several years. After I was sober from alcohol and cocaine, it took me about a year and a half to say, look, I think I got this. But that's by writing all the time. Now, I was going to therapy, I was going to AA, all of those things. But if I wasn't training my mind and writing my mind, I mean, mind hygiene is a process that you can use. You can also call it journaling. You can call it entry, whatever else, diary, whatever else that you want to call it. I call it mind hygiene, where I'm writing constantly. Let me see if I even have something here in my bag that oh, how about this? Yeah, now I'm sitting here writing every like single day. Here is something that I wrote the other day, and there are probably, okay, I don't want to spend too much time looking here into my folders. But when it comes to writing and writing techniques, you just cannot skip any time and you can't skip any day. You have to keep on writing. Instead of saying that you want to fix, overcome, and treat addiction, or like go to some type of rehab or go on a diet or go on an exercise regimen, instead accept, embrace, and follow it up with compassion. What does that mean? That means that if you take an action step, that's compassion. Self-empathy is where you understand that nobody sat there and taught you. And then most importantly, you want to soften the process. And this is where you can write down ACE is your life with mind hygiene. A is accept your awareness, C is communicate your compassion, E is embrace your empathy, and S is soften the process. Don't make it seem like it's difficult, hard, or stressful. Is it more stressful to feel bad? There's something I was reading about Brian Tracy just maybe today or yesterday. I can't remember. I was listening to his audiobook, not reading. And he talks about, is it difficult to be stressed out or is it difficult to be a millionaire? Like, which stress do you want? Probably the stress of regret is what you don't want. And here's the thing, is that you don't want to be regretful. 100% of people want to do the right thing all the time. 99% of people will not do it. 1% of people will try for some time. 0.0001% will maintain it for life. Do you want to follow these people? Do you want to fall into this category? Do you want to be spending all of your time in your 60s and 70s in hospitals, taking medications, having problems. No, what you want to do is you want to write down, I accept my awareness. I accept that this is what I'm doing, but this is what I will do. And if you're not ready to do it now, that's okay. Now you don't have to be hard on yourself because you're taking time to write it down. It's an action step that you don't want to do. There's medical evidence to support that when you do small things that you don't want to do, your brain rewires and the reticular activating system rewires its dopamine input. And what happens is that you get more dopamine when you keep on writing these things down. Remember, there's going to be never this fancy day where you're going to just figure out everything. You're not going to have this one day where everything is going to be great. But if you can cruise along 70 to 80% of the day, even I've had some 40 to 50% days just this past week when nothing really happened, but as I keep on writing, I get myself back into that 70, 80%. You have to understand, I live alone. I have 3 pets. I'm single right now. And, when it does come to this, I have to rely on myself, and I can also rely on this community and my patients too, because I get to inspire them and I get to inspire you, which helps me along my journey. That means that one of your treatment plans could be inspiring somebody else. In review, you don't want to be in regret when you get older. You don't want to fix addiction of any kind. You want to accept and embrace it. Write it down, find the people who are looking for solutions, and be nice to yourself and feel better about yourself. At the end of the day, that's what matters, is that you want to feel good. Namaste.